Which of the following are signs of attention? That's going to be a tracheal shift away from the problem, diminished breath sounds on the affected side, and if you were going to do percussion, you would feel actually, or hear, hyper resonance, not hypo resonance to percussion. So that's why it's not all of the above. Nikki's taking the lead. Which of the following is a special indication for IPPV therapy? And that is, of course, to decrease venous return, which will decrease cardiac output, and also for patients who have pulmonary edema. He's keeping her lead. The term sustained maximal inspiration means synapse spirometry, or IS. Okay, when administering IPPV therapy, how could you increase the tidal volume? By increasing the pressure. Remember, if you increase pressure, you increase volume. If you decrease pressure, you decrease volume. And what is the proper instruction for using a PEP device? You want your patients to perform 10 to 20 breaths, then cough, and then they can resume. Good. When instructing a patient to use IS, you should tell the patient to you want the patient to put the mouthpiece in their mouth, create a tight seal, inhale slowly, completely fill their lungs, hold that breath briefly for about 5 seconds or so, then passively exhale. So either one of those, blue or green, would have been fine. When is air trapping likely to occur? That would be when the I time is too long, because that means your patient doesn't have enough time to exhale all of that volume of air that you just gave them. Your E time being longer than your I time, it should be. Okay, really no such thing as a too long of an E time, unless your rate's too high. And then sensitivity being too high is going to cause auto cycling. Doesn't have anything to do with air trapping. What role does the RT play in providing effective IPPV therapy? The most important factor in providing effective therapy is you, the RT. If you don't instruct your patient properly, if you don't set the machine properly, you're not going to have effective treatment. You could even hurt your patient. And Taylor is taking the lead. When using the air mix setting and O2 as a gas source, what FiO2 is the neg driven on the bird mark setting? Or sorry, bird mark 10, that medicine. And so that's gonna, if your machine is attached to, has an oxygen hose on it, it's put into the oxygen on the wall. Remember, your nebulizer is always driven by whatever your gas source is. So if your gas source is oxygen, it's gonna provide 100% oxygen. If your gas source were air, then it would provide 21% oxygen because air is 21% oxygen. You can take or leave it. Which is not a contraindication of IPPB. Emphysema. So just because a patient has emphysema doesn't mean that you cannot do IPPB. Just means that you need to make some special considerations, like making sure that they have adequate exhalation time and making sure that your pressures aren't too high. Okay, all modes of lung expansion therapy. They all increase the transpulmonary pressure. That's how they allow for the lungs to expand. Okay, which of the following would indicate that a patient's atelectasis has not improved? That would be a decrease in your FVC. So if your patient's FVC or VC is decreasing, that means that they're getting worse, not better. If your patient's IPPB machine cycles on but does not cycle off, what is most likely the problem? Good, there's a leak in your system. If your sensitivity was set improperly, again, it would auto cycle, meaning it would come on by itself. It's not that it would be triggered by the patient, then not cycle off. Okay, 17, your patient refuses therapy. What should you do? Good. Explain why it would benefit them, explain the consequences. If they still refuse, document their refusal. You can even tell your supervisor if that's necessary. What patient parameter should you monitor during IPPB treatment or therapy? And a patient parameter, the only patient parameter here is the patient's exhale tidal volume. The rest of these are machine parameters or your settings, okay? So remember, for your patient, you want to monitor their heart rate, respiratory rate, their exhale volume. You can ask them yes or no questions, breath sounds, things like that. Okay? Which is not a classification of the bird mark 7. It is not double circuited, it is single circuited. Good job. What is an appropriate sensitivity setting? It's going to be -1. So -1 to -3 centimeters of water pressure would be appropriate. Not +3. It's got to be a negative number for your sensitivity. Which of the following cannot be used to measure tidal volume during IPPB? And that is your TriFlow IX. You cannot use an incentive spirometer to measure your volume. You can use a Venti comp bag. That was what they used on the video I sent you. You can use the Wright respirometer or the Borns LS75 respirometer. Okay, when using a Birdmark 8, an increase in flow rate will cause it will cause a decrease or shortening of the I time by making the flow faster. Which of the following is not a hazard of IPPB therapy? So hemoptysis is not a hazard, it's a contraindication of IPPB therapy. You can cause oxygen-induced hypoventilation, especially if you're using oxygen as your gas source. You, of course, can cause hyperventilation. And if you use too high pressures, you can cause a pneumothorax as well. Let's take a minute. When your patient begins to hyperventilate and becomes dizzy during IPPB treatment, what should you do? You should allow them to rest and instruct them to breathe slower. Which of the following statements are true regarding IPPB? Okay. And that it should be done 3 to 4 times a day. Your patient should be told what to expect. Your patient should not be put in any postural drainage positions, and your patient definitely should not be breathing as rapidly and deeply as they possibly can. Remember, this is passive. You want your patient to breathe at a slower rate and let the machine do the work. They shouldn't have to breathe deeply. Which of the following is an indication for IPPB? And that's the patient's vital capacity is less than 3 times their tidal volume. That's what tells you that the patient needs to take bigger breaths because they can't on their own, so they need IPPB. Paresthesia is associated with which of the following? Paresthesia, of course, is numbness and tingling of the extremities because of hyperventilation. Which of these is associated with hyperventilation? That would be respiratory alkalosis. Okay, a decrease in pressure results in all of the following except Okay, and that, so a decrease in pressure or change in pressure at all will not affect your sensitivity. It will cause a decrease in volume if you decrease pressure, a slight decrease in eye time, and a slight decrease in flow, but won't affect your sensitivity. Which of the following is not a clinical goal of IPPD? That would be a decrease in venous return because, yes, IVPB can cause a decrease in venous return, but that's a special indication. That's not a clinical goal. Clinical goal are to improve your eye ratio, deliver meds, promote a cough, to minimize VQ mismatch, improve distribution of ventilation, things like that. Okay, and last one, what volume of air should be moved during an IPPB treatment? Good, and that is 3 times your patient's tidal volume. So you first have to figure out what their tidal volume should be. So that's 3 times their ideal body weight, and then 3 times that is what you should be measuring when you measure the IPPB volume. Okay, questions. Good job, Amanda. Good job, Nicole. Taylor, I think you had a clean sweep today. Good job. Okay, Flo and AJ, runners up. Good job, guys. Okay, any questions for any of your units?